Every story has an ending, but sometimes it's the beginning that makes all the difference in the world. I was born without trauma or complications. Actually, according to my father, I was the most perfect, beautiful baby in the NICU. I achieved all of the normal APGAR scores and was given a clean bill of health as I left the hospital. While I thrived and achieved in all the normal infant milestones, the one thing that I didn't actually achieve was walking on my own. However, my pediatrician had an answer for that dilemma. He said to my mother, "Do you have dogs?" And in response, she said yes. And my pediatrician said, "Well, your son thinks he's a dog." Now, while my mother did not like the idea of that, she put a smile on her face, but went down a deep and dark path to find the true answer to why I was not walking. I have cerebral palsy, which is defined as a group of physical conditions that affect my ability to walk. To be more specific, I have spastic diplegic cerebral palsy, which limits the movement in my hips and legs. I wear leg braces and use a wheelchair to get to my designed destination. My intention today is to raise awareness. How do we treat others who we perceive to be different? I guarantee that those of us with cerebral palsy want to be treated the same as everyone else. We want to have a chance to find happiness and success in the journey we call life. There are multiple factors which can cause cerebral palsy. Typical cerebral palsy with an unborn fetus, or starts with an unborn fetus. During pregnancy, if the mother develops an infection, the unborn child can develop cerebral palsy. These infections include chickenpox, rubella, or a high fever. Premature births, characteristically infants who are born before 37 weeks, or those who weigh less than 3.5 pounds, have a greater risk of being born with cerebral palsy. Multiple births, which can include twins or triplets, increase the risk of cerebral palsy. Primarily due to the low birth weights, premature births factor, and a lack of oxygen to the unborn child. There are several different types of cerebral palsy. The most common type, affecting more than 70% of patients, is called spastic cerebral palsy. There are three types of spastic cerebral palsy. Spastic hemiplegia, which affects one side of the body, such as an arm, leg, or hand. Spastic diplegia, which affects leg muscles, making them stiff. Spastic quadriplegia, the most severe type, affects the brain and all body movements. There is also a rare form of cerebral palsy affecting 10 to 20% of patients called athotoid cerebral palsy, which causes uncontrollable movements such as a thrashing body or irregular movements in the legs, hands, or feet. Another rare form of cerebral palsy affecting about 10% of patients is called ataxic cerebral palsy, which creates tremors, making it difficult to write, button clothes, or walk. Mixed cerebral palsy occurs when the patient has more than one type of cerebral palsy. According to the Mayo Clinic, the brain disorder causing cerebral palsy doesn't change with time, so the symptoms usually don't worsen with age. However, there are many noticeable indicators. Difficulty walking due to scissor-type gait, difficulty eating or drinking, delays in speech development or speaking, difficulty with minor motor skills, stiff muscles or lack of muscles in arms, legs, hands, and neck. Thankfully, There are a variety of treatments that help a patient to gain some muscle and body movements. Physical therapy is an important part of managing cerebral palsy that should start in infancy. Occupational therapy teaches the patient how to do everyday activities. Recreational therapy helps to improve a patient's physical and intellectual skills. Speech therapy helps the patient with speech, communications through sign language, and even swallowing. Orthopedics help improve leg movement and balance by using leg braces, wheelchairs, electric scooters, and walkers. Surgery is also available to patients with severe cerebral palsy, which help correct legs, arms, hand movements, or lengthening muscles. Surgery can also include cutting nerves and lessen spastic arm, leg, and hand actions. A doctor can prescribe a certain medications to relax muscles with aid in walking, talking, and eating. My story is simple. While I have spastic diplegic cerebral palsy, I was given a chance to live a normal life. My mom never treated me as if I had a disability. Therefore, I had to learn to get up when I fell and do chores around the house. I never learned to feel sorry for my physical abilities. A track coach of mine in high school changed my life. With his help, I began competing in track events using a hand cycle. I became an advocate to others in my high school who had cerebral palsy or different types of disabilities, and helped to establish sporting programs for students in Idaho with physical challenges. Do we have the right to determine how we treat others by the way we walk or the wheelchair or leg brace that they use, which enable them to walk? The answer is no. While cerebral palsy affects a person's physical abilities to walk, it does not affect their ability to feel sorrow or happiness. Everyone wants to find their inner peace within themselves and utter success with those around us. I will admit the statistics surrounding cerebral palsy is foreboding. 1 out of every 325 infants is born with physical disability, or with this physical disability, in which there is no cure. But there is hope. Through physical therapy and occupational therapy, medication, and loving support from family and friends, those of us born with cerebral palsy can live the lives we never dreamed were possible. There's a quote by Booker T. Washington, which I use as my motto in the days that I live my life. It says, "I have learned that success is to be measured not so much by the position that one has reacted or reached in life, by the obstacles which he has had to overcome while trying to succeed."